All right. Today, we're diving into something that's, well, it's sneaky. It often hides in plain sight, starting with a feeling most of us have had, and let's be honest, probably just brushed off. So let's get right into it. Think about it. You're walking, and bam, that sudden, tight, seizing pain in your leg. We've all been there, right? But what if that cramp, especially the kind that only seems to show up when you're moving, isn't just a simple muscle cramp? What if it's actually a pretty serious warning sign from your body about your circulation? So to really wrap our heads around what's going on here, let's use a super simple analogy. I want you to picture your entire circulatory system as this huge, complex network of pipelines, kind of like the plumbing in a massive building. Okay, so the main problem here has a fancy name, arterial stenosis. But all that really means is that the arteries, those pipelines carrying all the good, oxygen-rich blood from your heart, are getting narrow, or even totally blocked. And the number one reason for this? Something called atherosclerosis. Basically, it's a buildup of this gunk, this plaque inside the pipes. And you know what happens when a pipe gets clogged, right? The flow slows to a trickle. Well, it's the exact same idea here. This plaque is literally choking off the blood flow to your limbs. So the big question is, how do you even know this is happening? How does this clogged pipeline first start waving a red flag? Well, more often than not, you'll first notice it when you're up and about, when you're actually moving. You know, doctors have a pretty clear way of tracking how this disease progresses. They break it down into 4 stages. And it's a real journey. It can start out completely silent with 0 symptoms, but then it moves on to pain when you're active, and then, more seriously, pain even when you're just sitting down. The final stage, well, that's when things get really critical, with actual tissue damage. So let's walk through this, from stage 1 all the way to the end. So in stage 1, you'd have no idea anything is wrong. You're completely asymptomatic. A blockage might be slowly building up, but it's just not bad enough yet to cause any real trouble. But as that clog gets worse, we slide into stage 2. And this is the turning point. This is when your muscles, especially when you're walking, start screaming for more oxygen than that narrowed artery can possibly deliver. And that is when the pain kicks in. And this isn't just any old pain, it has a very specific name, intermittent claudication. And it's exactly what it sounds like, a really nasty cramp-like pain in your muscles that shows up when you exercise. Why? Because your muscles are literally being starved of the oxygen they desperately need. Okay, but wait, you might be thinking, how do I know this isn't just, arthritis or a pulled muscle? And that's a great question. There are a few dead giveaways. See, this pain is different. It doesn't usually hurt on your very first step. Instead, it reliably builds up as you walk. And here's the real kicker. It's also reliably relieved by just a few minutes of rest. Poof, it's gone. And it's a pain deep in the muscle, usually the calf, not in your joints. Spotting this difference is absolutely crucial for catching this thing early. But what happens when that blockage keeps getting worse? Well, the pain starts to change its tune. It's not just an occasional visitor anymore. It becomes a constant companion, one that you can't just shake off by sitting down for a minute. And that, my friends, brings us to stage 3. At this point, that clog in your artery is so bad that your legs aren't getting enough blood to meet even their most basic, rock-bottom needs, even when you're just sitting on the couch. The pain is now constant. And this is what doctors call rest pain. And let me tell you, this is a very particular kind of pain. It has some really specific calling cards. It tends to get way worse at night when you're lying flat because now you don't even have gravity helping to pull blood down into your feet. You'll see people finding the only relief they can get is by dangling their foot over the side of the bed. It can get so severe that some people end up sleeping in a chair. And get this, for some, even the light pressure of a bed sheet can be absolutely unbearable. From here, we move into the most critical and, frankly, alarming stage. This is where the severe lack of blood flow starts to cause damage you can actually see. This is stage 4, and at this point, the leg is so profoundly starved of oxygen and nutrients that the tissue itself starts to break down and die. The official term for this is critical limb ischemia, and make no mistake, this is a full-blown medical crisis. One of the most dramatic signs doctors look for is something they call the sunset foot. It's pretty wild. When you lift the foot up, it goes pale, almost waxy white, because there isn't enough blood pressure to get the blood up there. But then, when you let it hang down, it turns this deep, dusky red or even purple color, as what little blood is available just pools there. That crazy color shift is a massive red flag. When your skin isn't getting the blood it needs, it becomes incredibly fragile. A tiny scrape or bump that would normally heal in a few days just doesn't. Instead, it can turn into these painful open sores or ulcers, and they typically show up on the toes or feet, right at the end of the line where circulation is the absolute worst. And this is the final, most severe outcome. This is gangrene. It means the tissue has actually died because its blood supply was completely cut off. There's no mistaking it, and it is an absolute medical emergency. Okay, so let's say you're noticing some of these signs. How does a doctor actually figure out what's going on and confirm the diagnosis? Well, they have a few key clues they look for. Now, this is actually pretty fascinating. The location of your pain can be a huge clue as to where the blockage actually is. The general rule of thumb is that you feel the pain one major joint below the actual obstruction. So, for instance, if the clog is in the femoral artery way up in your thigh, you're going to feel the cramps down in your calf. It's like a roadmap for your doctor. All right, so let's do a quick recap and pull all of this together. The key features we've talked about are that classic intermittent claudication, the pain with walking. Then, the progression to rest pain. After that, you've got the visible signs, like the sunset foot, ulcers, or even gangrene. Of course, a doctor is also going to be physically checking for things like weak or even absent pulses in your feet, and they'll see how quickly the color returns to your skin after they press on it. And that really brings us to the most critical takeaway here, and this is a clinical pearl taken straight from our source material. The message could not be more clear. If a patient has pain when they're resting, or if they have ulcers or signs of gangrene, their leg is considered to be imminently threatened. And that's not just a scary phrase. It means they need urgent, immediate vascular assessment and intervention, period. So that brings us right back to where we started. That nagging leg pain you might be feeling, could it be more than just a simple cramp? Look, it might be nothing at all. But it could also be your body's early warning system, trying to get your attention. The only way to know for sure is to listen to it. So the real question I'll leave you with is, are you?